Okay, we're gonna go through these drills exercises for your hip, and it's your left hip that we're talking about, but you can also do this on your right side. So what you're going to do is, first one, you'll get something you'll have in your hand as your near target. You'll have it on the left side of your body, and you'll have your far target would be on the left side of your body. So you're going to switch your gaze between the close target, near target, and the far target. You can do that for about 30 seconds. That's the first one. The next one is the pencil push-up with isometric. So you bring the pencil, hold it as close where you don't see doubles, could be blurred, for 5 seconds, and then you take it out. And you repeat that about 5 times. The next one you're going to do is what we call fast saccades, horizontal, which means you're moving your eye, switching your eye back, left, right, left, right. So you want to do it as fast as you could, and do that for 30 seconds. And then you'll do fast pursuits, smooth pursuits. So you'll have something short and fast. You go, you follow with your eyes, then you do it. Follow with your eyes. Nice short ones. All right, you can do that for anywhere between 10 and 30 seconds each. And now you're going to do where you're going to stand up, and I'm going to show you. I want you to do this. You'll get in a partial lunge position. So you're in a partial lunge, and you're going to do this with both your left leg in front, the right leg back. Then you're going to switch and do it the other lunge. So you're going to be like this, and you're going to rotate your head quickly to one direction. Hold it for 10 seconds. You don't fall over. Do it to the other direction. Hold it for 10 seconds. Then you're going to go up 10 seconds. Down 10 seconds. Up left 10 seconds. Down right 10 seconds. Then up right 10 seconds. Down left 10 seconds. And you do it on both sides with both feet in front. As you get better, you make the lunge, your feet apart smaller to the point where your heel is touching your toes like this. So you'll go from this eventually to this, to doing it on one leg. And when you could do that, you'll then close your eyes and do these. All right? Then the next one you're going to do is you're going to take your left leg back, turn it out, take it away from your body, right? You'll have your hand in front, pressing your heel into the floor, tucking your tail so your butt is tight. Breathe in, hold your breath. Bend your wrists and fingers back, holding the breath. Try to see if you can hold your breath. Do this about 3 times, holding your breath. About 20 seconds each time, if you can make it to 20. Right? You're going to do that 3 times. All right. Now we're going to go through the nerve glides. First one, you're going to cross your leg, right? Your left leg, pull it there. You're going to bend forward from your tailbone, just above your tailbone. You bend all your spine. You should feel something immediately in your butt area. Then you're going to rotate from the lumbar spine. Not much of a movement. You'll feel it even more. Once you get there, you stay there. You pull your knee up like this 5 times. All right. Then the next nerve glide, you're going to put your knee on a chair or something, like you're in a lunge, so you feel a stretch through here. You're going to rotate your spine towards the other side. You'll feel the stretch even more. Flex. You might feel a little more, and then once you're there, you just flex your whole spine with the rotation up and down 5 times. Okay? And those are the 2 nerve glides that you're going to do. And now for the motor control for your hips. You want to have that control of your hips and moving them precisely. So you're going to lift up with your knee here, and you're going to draw a figure 8. And the goal is to keep your foot under your knee. You don't want it waving out. Under your knee as you're drawing that figure 8 with your knee. You're going to then bend the knee, take it out to the side, and you're going to draw that figure 8. Half of the figure 8 will be there. Half of the figure 8 is in front, and half is at the back as you draw the figure 8. Right? Then you'll take the leg back, bend, take it back, and draw the figure 8 behind. All of this will be hard again. Is to get that control of your hip. And the last one is bringing the hips up, taking it towards the midline, and draw the figure 8. And you're going to draw the figure 8 5 times in one direction, 5 times in the opposite direction. Right? And the next thing you're going to do now is the muscles you're going to learn to contract the muscles that surround the hip, right? So you adjust this camera so you'll be able to see. All right. First one we're going to do is the deep muscles that contract. That we call the hip rotator cuff. Um, uh, the little small external rotator deep in the hip socket. So to stretch them, you're going to, you can lift your foot off the floor and internally rotate your hip. So right down here, you'll feel stretching. Then to externally rotate, to contract, is to externally rotate the hip. Right? That's a stretch and contraction. The next one you're going to do is for the piriformis. So to stretch a piriformis looks like this. You internally rotate the hip and take the hip towards the midline, keeping your pelvis square, taking the hip towards the midline if you want to help it. So you get that stretch across your butt. And the contraction, you externally rotate, take the hip away from the midline, away from your body. And that's a contraction, stretch, contraction. Then you have the glute medius. You got two fibers. You got one in front and at the back. So to do one of the fibers, the stretch would look like this. Up, rotate, and take it across. With the midline, that's stretching. Then you go from there, you externally rotate, take it away and back. And that's a contraction. That's the posterior fibers. All right? Then for the anterior fibers, you rotate the leg, externally rotate, take it back, right? And then cross over and tuck your tail and what we call a posterior tilt. And you feel the stretch in front, right here, all right? And then the contraction would be internally rotate, flex, and take it away from your body. Those are for the glute medius. And the last one is the glute maximus, the two fibers, lower fibers and upper fibers. So to stretch the lower fibers, internally rotate and take, the upper fibers, and you take this across, stop moving your pelvis, and then to contract, externally rotate, lock the knee, take it away, and tuck your tail. Feel it at the top. All right, that's the upper fibers. And then the lower fibers, you internally rotate, take it away, feel the stretch. Internally rotate, take it away, get the stretch here. Then you turn, externally rotate, take it across, tuck, and you feel the lower part, right down here. Keep the knee locked, tuck the tail. Keep. Those are the 4 exercises, contraction that you'll do. One of the most important things with those, you'll do each one of them 6 times. The first 2 times is to get into the position, feel comfortable contracting. The next 2 is to actually try to contract the whole entire length of the muscle. And the last 2 is to put more effort to contract as hard as you possibly can, well, not as hard as you can, about 70% to start. As you get better, you can contract it harder with more and more effort, as close to 100%. And those are the drills and exercises for your hip rehab.